Anti-pharmacist is here again this week to talk about yet another health topic. And today we want to look at scabies. Why did I choose scabies? 3 reasons. First, it's becoming common nowadays to see people with scabies. I've had several cases in my pharmacy in the past 3 weeks and 3 months. 2, it is misunderstood, confused for a bacterial infection, and you see people using antibiotics for it. It won't work, and you've only added to the burden of antibiotic resistance, which the world is tackling seriously. The next one is triple action cream. Because of the itching and the rashes, the first thing that comes to our mind to apply many times is a triple action cream, which, because of the steroids, of course, we look as if it's working initially, but later on it won't work. Not only will it work for scabies, but it will also damage the skin. You see, triple action cream have a whole lot, it's a story for another day, whole lot of issues behind triple action cream. And so I said, hey, it's time for us to create awareness about this thing called scabies. So how does scabies look like? It's a rash on the skin, raised kind of rash, dot, bumpy kind of rash, pimple kind of rash, you see them dotted on the skin, causes intense itching, especially in the night. It appears commonly on the arms and the legs. However, it can also appear anywhere in the body. So I found children with scabies on their buttocks. I found children with scabies on their penis. So it can harbor, you can find this rash, this scabies rash, in the genitals, the buttocks. Those ones are not too common, but most commonly we find them on the hands, particularly the webs of the fingers, in between, and the feet. But we can still find them, as I said, anywhere. Okay? Now, what causes scabies? It's a tiny bug. You can't use your naked eyes to see it. You need the aid of a microscope. The name of the bug is mite. It belongs to the family called arachnid. It's not from the insect family. It looks like an insect, but it's not an insect. Insects have 6 legs. The arachnid families, the bugs from the arachnid family have 8 legs. Spiders and scorpions, they belong to that family also. But don't worry, the mites, though with its intense itching and very, very disturbing and discomforting, is not life-threatening like the spider's stings or the scorpion sting. No, it's not life-threatening, but it's irritating. It's not something you want to have on your skin anyway. Now, who is affected? Anybody can be affected. Children, adults, rich, poor, female, male, anybody can be affected with scabies. It's not just about poor hygiene causing it. So whether you are the high class or the middle class or the low income class, anybody can have scabies. Okay? How is it transmitted? Prolonged skin-to-skin contact with somebody who has scabies. How is it treated? Well, there are anti-scabies creams or lotions that your healthcare provider will recommend. So if you suspect you have scabies, it's good to visit your healthcare provider. They will recommend anti-scabies cream or lotion, and in some cases you will need to take an oral tablet and or anti-scabies oral medication for cases that have become prolonged. And when you scratch, it takes your germs, bacteria from your fingers into the rash, so you could also get it infected with bacteria in addition to the original scabies. Your healthcare provider may also recommend antibiotics. And for the itching, because it's so intense while the medications are working, an antihistamine. Antihistamines are meant for allergic reactions. And of course, the mites, why we itch from scabies is because the mites deposit feces and eggs, and even the mite itself. Those things trigger hypersensitivity reactions in the skin that cause those itching. So the antihistamines will counter those reactions and suit away the itching, so that you don't have to start scratching. So this is the approach to treating scabies. So if you know or suspect anyone or yourself having scabies, it would be good to visit a healthcare professional. You could walk into a pharmacy, ask for the pharmacist, and show the skin rash, and they discuss treatment options for you. Now, how do we prevent ourselves from getting scabies? If you suspect somebody has it, the best thing to do, because it takes about 4 to 6 weeks for the symptoms of scabies to appear on an individual. So somebody could be infected already. So if you see somebody who is already having these symptoms, and it's maybe like a family member, you're sleeping on the same bed, prolonged skin contact, it's safer to just take the medication, especially when children are involved. a child already has it, it's better you just treat everybody in the house at the same time so that there's no reinfection from any source. The beddings that the person slept on should be washed. The ones that cannot be washed should be exposed to sunlight. You see, scabies, the bug that causes scabies, cannot last more than 2 to 3 hours outside of a human being. That's how dependent it is on human beings. So if you expose such things like the mattress to sunlight, you can be sure the bed bugs, I say bed bugs, the mites will die. Wash the clothing, the personal things of those things you can wash with hot water. That prevents all the spread of the infection. For school children, and this is a word to teachers, if you observe a child has those kind of rashes, you always see them, they are scratching those rashes. It's best to notify the parents. Let that child stay away from school and get treated before coming back, because we've seen in my pharmacy I have seen it though, a particular school, you know, in your community where the pharmacy is located, you will see this one student coming from that school, coming from, as in, you know, children now, this touch is very common with children. They touch each other a lot and all that. So as a teacher or a proprietor, if you are listening to this video, it's also good for you to be on the lookout so that they will not tag your school as a school that their child got scabies. And that way we can also prevent them, because I don't know why of recent it became a common occurrence to see scabies. Having said all this, it's still good for you to talk with your healthcare provider. It may not be scabies, but when you talk with them, I'm suspecting this may be scabies, you will get more information about them by the time they examine the skin of the child or the person involved. Okay, in conclusion, as I said, scabies is becoming pretty common these days. Antibiotics won't work for it as in primarily, so it's good to also know how they appear. And I said they appear as pimples or bump or rash, dotted, particularly on the arms and the legs, the webs of the fingers or the feet, but it's gonna occur any other place. Like we have seen genital scabies, around the buttocks scabies also. So if you suspect anybody has this, visit a healthcare provider and also practice the prevention tips we have talked about in this video. I hope this has been informative. I would love your feedback. What else can we do to prevent the spread of scabies? What measures have you done? Have you seen anybody around you having such a skin condition? Please, I will love to hear your feedback, and I hope this is useful to you also.